Welcome to the webinar today. Today's webinar is sponsored by the Medical Association of Georgia and its Indie Practice platform dedicated to help independent medical practices, private practices. My name is Mark Maloney. I'm the CEO of VenOps. We do compliance for over 1,000 independent medical practices, and my guest today is Dr. Jeff Segal, who is the founder and CEO of Medical Justice. Dr. Segal is a graduate of Baylor College of Medicine, where he also did his neurosurgical residency after graduating, and he did his fellowship at the University of South Florida in spine. He has also started and he sold a biotech company, and after much work, he completed his law degree, and that helped him start a consulting service, a company called Medical Justice, to help other doctors with challenging situations on the legal scene. So without further ado, I'm going to turn the floor over to Dr. Segal, and we have about 30 minutes. There'll be plenty of time for questions, or stop at any time, and you can also use the chat function. Dr. Segal, welcome to Indie Practice Presents.
Hey, thanks, Mark. Great to be here. With your generous introduction, one would come to the conclusion that I struggle to keep a job. So anyway, I'm going to turn up my camera. We'll go through the slideshow here. Give me 1 second while I do this, just so it's not occupying the entire screen. There we go. So today we've got a whirlwind tour of how to just manage conflict. And I'm a lawyer and a physician, and I defend doctors. Let me just get this slide set up. And the good news is most patients love their doctor. They're not only happy, they love their doctor, but not everyone loves their doctor. And it's normal for conflict to occur. Conflict is part of the human condition. The challenge is nobody's going to beat us up harder than we beat ourselves up. And even if you just have 1% of your patients or even less who are unhappy, it goes right into the middle of our brain. And these are seen as unruly tenants that probably need to be evicted. So we'll talk about what triggers it, how to detect these people before they consume your brain, and what to do if you did not detect them and you're in the middle of a full-flung conflict. All right, so prevention is better than trying to perform the surgery after the fact. So if you can identify a problem sooner rather than later, you're going to be better off. So the first question is this patient bad-mouthing other doctors? Is this patient bad-mouthing other doctors and then praising you effusively? I ran into this problem and I was not aware of this warning sign when I first started my practice. My first year of practice, I had a patient come to me. She said, "Dr. Segal, I'm so glad I found you. The 3 prior surgeons, they're all butchers. They just finished me off, but I've heard so many wonderful things about you. I'm hoping that you can fix me." Well, of course, my head blew up. I was so delighted that she was patting me on the back. And what did I do? Did I send her on her way? I did not. It was my first year of practice. I was flattered. I operated on her. Predictably, I became the 4th butcher down the road. So there was no way anybody was going to help this individual. And, just looking objectively at what had been done to her, there was no butchery that had taken place. But if a patient is bad-mouthing the prior providers, it's not a good sign. You likely will be the next butcher in line. Identify a problem early by listening to your staff. You only have 2 eyes, you have 2 ears, but your staff is that's your extended eyes, your extended ears, and they're going to hear things you never hear. I generally recommend implementing the 1 person red flag rule. What is that? If 1 person on your staff says, "I don't have a good feeling about this patient," I listen attentively. I want to know why they feel that way, because frequently it turns out they are right. And so the customer is always right, but just remember, not everyone has to be your customer. All right, so the typical, well, there are multiple ways they manifest themselves as being challenging patients. It could be rude to a staffer on the telephone. They may go ballistic with your biller. They will schedule, cancel, reschedule. And fascinating enough, they love you. They love the doctor. Um, but you have all these things going on in the background, rude and unpleasant to everybody else. They love you until you until they have a procedure done, and then you become just like everybody else. You then go from being a demigod into Satan. Now a break for mental health. We live in an era where there are a non-significant or a not insignificant number of people with mental health challenges. They may be temporary, they may be permanent, but if they come into your practice with something that objectively can be fixed, but the trigger, is actually a mental health problem, you do need to pick up on this. And so objectively, you may believe that the patient had an excellent outcome, but if in their brain they believe that you are the butcher that they believe you are, this is a challenge. You're trying to overcome perception. So trying to get a better understanding if a patient has a mental illness is very useful before you make a decision to invite someone into your practice. And then, kind of on the edge of whether it's a mental health problem or whether it's a communication problem, were expectations properly set before the procedure? Expectations related to um, money, recovery time, and the range of outcomes. The more you identify upfront, the more you can see whether the person really is a good candidate, and post procedure, whether their expectations are likely to be met. All right, when people are unhappy, they manifest themselves in multiple ways. At the bottom of the list, they yell, they raise their voice, the amplitude goes up. They put pen to paper, metaphorically. These are nasty emails, rotten phone calls. Next step up is posting online reviews. Gone are the days when it was just a matter between two people. Now it's a matter between the patient and the internet at large, and there are a number of review sites that control the narrative. You don't need 100% positive reviews, but you want mostly positive reviews. More on that in just a few minutes. They don't need a lawyer. If the amount of money that they're looking for is not particularly great, they can file a claim in small claims court. Every state is different. Most states, the maximum amount is on the order of about $3,000 to $5,000, but Texas, interestingly enough, redid its rules, and you can sue up to $20,000 in a small claims court in Texas. Not in Georgia yet, but the amount is lower. But who knows? As Texas goes, sometimes the other states do follow. Next up, the food chain, a board of medicine complaint. It requires little more than just pressing submit to an online form, requires no effort whatsoever. The board of medicine is mandated to investigate every complaint. Most complaints go nowhere, but you still have to respond to it. It's time consuming and does irritate your brain. Then finally, if they can persuade an attorney that they have been injured, a full-on lawsuit. If the patient likes you, they're less likely to sue. It doesn't mean they will never sue, but if indeed you have good rapport, good communication, the likelihood of ending up in a lawsuit goes down. All right, I keep getting a question, patient wants their money back. This is particularly the case in the cash pay world, for example, plastic surgery, concierge medicine, weight loss procedures, demand for refund. My mantra is pretty simple. If you give, you got to get. If you get, you got to give. You need to come up with an agreement. You want this to be one and done. The last thing you want is to give the patient back their money, and then they come back 6 months later and they go, doctor, thank you so much for giving me back the money I paid you. But it turned out I had to go see your competitor to redo the butchery, or actually revise the butchery that you created. And that fee was on the order of $9,422. Would you be kind enough to underwrite that new expense? And if you had gotten a release, you would not have to suffer that conversation. Well, you may have to suffer it, but you wouldn't have to do anything. You would just pull out the document and say, wait a minute, we had an agreement. I'm so sorry. All right, let's go through a real world example in our whirlwind tour. So here, the patient had trash talked prior doctors. Remember my rule of thumb number one. And the new doctor, the current doctor in this vignette is, walks on water, does everything properly. The patient ended up having a collection of weight loss procedures, not non-invasive, and never came back. So we have no idea what happened, although she did call down the road and said, hey, guess what? With those procedures that I paid a lot of money for, I got no improvement at all. I see nothing. And so the practice reasonably said, well, please come back to the office so we can do an evaluation and then we can look at options. So the patient said, well, I need my money back or I'll destroy your practice online. I need my money back or I'll destroy your practice online. So look how they've connected that. If you don't give me money, I'll take some type of negative and deleterious action. All right, so we've got a program. It's called the Disappear Program, stands for the Definitive Innovative Solution, addressing pissed off patients expecting a refund. It took longer to come up with that acronym than to develop and implement the program. What is it? It's a letter that goes out to the patient, which basically says two things. We want happy patients, and we're open to the idea of refunding some of your money because clearly you're not happy. But I need to remind you that you're tying the demand for a refund to destroy my reputation online is not legal. It's a criminal offense. In California, it goes by California Penal Code, Section 519. I can assure you every state, or at least virtually every state, has an analogous extortion criminal statute. And the final line in the letter is, look, I'm open to giving you some money, but you need to sign a release agreement. And by the way, if you do make good on your threat, I will turn this over to the district attorney. Will the DA actually pay attention to this? Well, they're typically busy with rape, robbery, and murder. But if you know a DA, they will pick up on it. And like I said, the written demand is a criminal offense with criminal penalties. All right, litigation. I just want to pause to put in a plug for arbitration. I'm a fan of arbitration. Arbitration is an alternative venue to court. Arbitration is an alternative venue to court, and there are a lot of rules that you can implement if you choose arbitration. For example, you can mandate the type of experts that will be used to opine on a case. Now, generally, arbitration cannot be one-sided. To make sure it's enforceable, the process must be perceived as being fair, reasonable, and mutual. So you can't put your thumb on the scale. You really have to, make something that looks like it's even and balanced. Why arbitration? Why am I a fan of arbitration versus going to court? Well, it's typically faster. It's less complicated, doesn't require as many bells and whistles to implement, so it's not going to consume your life the same way a court case would. Arbitration is private, meaning that, well, a court is open. Court is part of a public record. Arbitration is private. It's impartial. If you go to court, it's the luck of the draw in terms of who you get as your judge. In arbitration, the two sides mutually choose their so-called judge. And in terms of cost, I mean, if you got insurance, this may not make much of a difference, but in terms of cost and time, it's generally less expensive. Arbitration generally costs less in both time and money than going to court. What are some of the other advantages? Well, the one that I like is identify the experts in advance, or at least the type of experts in advance. It would be, you would specify it's in your specialty with your board certification. Why is this relevant? It avoids turf wars. So for example, I'm a neurosurgeon by training. If there's a beef with respect to the type of care I delivered, I would certainly want a neurosurgeon opining on it. And they may show up with a spine surgeon, an orthopedic surgeon who may dabble in spine, someone who's not spine fellowship trained, but somebody who mostly does hips, knees, or ankles, and occasionally, maybe 3 times a year, does a spine. I don't want that individual testifying against me. And it's easy. In arbitration, you can certainly identify what type of specialty will be opining on this. With court, you have to depend upon the good graces of the judge to accept your argument. Sometimes they will, more often than not, they will not. The other thing that I like about arbitration is that if you're in a war with a local competitor, you can carve out a zone, a geographical zone where no experts can be chosen from. So, for example, you would put in the arbitration agreement that to make this totally fair, no experts can be chosen from a radius of 10 miles around my office. So is arbitration enforceable? Well, plaintiff attorneys don't love it, but yes, it is enforceable. How and why? It's been the law of the country for 99 years, coming up on 100 years, with the Federal Arbitration Act. And federal law generally trumps state law. State law controls what is considered a fair contract. So, for example, if you had the arbitration agreement in 4-point font, and it was buried deep in a collection of 100-page document, no, that the state would say that's not fair, and it would say that while we accept arbitration as part of federal law, since it's a contract, an agreement, it's not fair. So you just need to follow the state rules related to what's considered a fair agreement. But at the end of the day, is arbitration enforceable? The answer is yes. And here's my word to the wise. Do not cut and paste someone else's arbitration agreement. The rules related to arbitration do occasionally change, and you just want to make sure that it comports at least with state law if you are presenting an arbitration agreement for your patients to sign. I have seen so many cut and paste where it actually included the other doctor's name buried deep in there. It included a different specialty. It included terms that have been overruled in the past. Just go to a lawyer and get an updated arbitration agreement, and you'll be glad I sent you there. All right, we have time. Let's just do a part of our whirlwind tour with online reviews. I'm not a fan of responding to positive reviews. Everybody loves positive reviews. They speak for themselves. What about negative reviews? Everybody hates negative reviews. So yes, they are a nuisance that need to be managed. And sometimes they can be totally deleterious to your practice and actually impact the bottom line. So can you respond to a negative review? Can you respond? And the answer is yes, you can respond, but you need to respond broadly. And I underline that word broadly to the criticism, and you cannot reveal any protected health information. So you need to be very cautious in terms of how this is done. We'll go through an example in just a second. In fact, here we are now. So here's a prototypical review. Lots of butcher themery here. So here, Dr. X is a butcher. He botched my facelift and now wants to charge me another $10,000 to fix his screw up. Obviously, something you don't want to see at the beginning of a workday. So this was a well-crafted response. I really like this. Most of our patients are delighted with their outcome. We wish all were. Still, for those who are dissatisfied, we will offer to perform a revision procedure within a reasonable time frame where we waive our professional fee. This does a lot of heavy lifting, but look what it didn't do. It didn't even talk about this particular patient. It's just talking broadly, and it's speaking to the public at large. It's not even speaking to this particular patient. So what did we learn from that response? Well, it says they're going to do a revision where they waive the professional fee, which is great. I mean, it tells prospective patients that there's a bit of you'll stand behind your results. You want the patient to have a good result. And while there's a comment about waiving the professional fee, there is no comment made for, well, you cover anesthesia or the facility fee. You may, but there's no commitment for that in the response. In addition, it says that you'll do a revision within a reasonable time frame. Well, what's reasonable? Well, we didn't say. I mean, it could be 1 week, it could be 1 month, it could be 1 year, but 5 years is probably not reasonable. You leave it ambiguous. And then it basically states that ultimately, sometimes you don't have perfect results. Welcome to the world of medicine. Every doctor will occasionally experience a complication or an untoward outcome. There are no physicians that have never had a complication. They don't exist. Either they don't look, they're lying, or it's their first day in practice. But by and large, everybody will have an outcome that they're not proud of. We just have to figure out how to manage that. And part of this is telling, in this case, is telling the public they won't need to underwrite your, unhappiness, that there's a way to potentially get this fixed, and they would be better off than before. Finally, the most important point here is do not debate. This is one and done. You say your piece and then you move on. You're not going to get into a back and forth. If you do, it has the potential to turn into a cyber mob. So say your piece, you're talking to the public at large, and you're not getting into a one-on-one debate with this patient. All right, what not to do. And I've seen, these are all real, by the way. I've seen all of these. I recommend against all of them. So here, Miss X continued to smoke after I advised against it. Next, blame the patient. She was not compliant with my recommendations. Next, blame the patient. She missed post-op appointments. Next, an ad hominem attack. Miss X, and this is real, by the way. Miss X is a despicable, money-grubbing, subhuman being. And actually had some other words in there which I left out for brevity. I wish she had not darkened my doorstep. These are real. This was posted on as a response on vitals.com. Do I have to state why this is not a great idea? It's just not a great idea. All right. How else do you solve the problem? The old surgical adage holds true. The solution to pollution is dilution, meaning if you have a collection of positive reviews and they are uploaded seamlessly to the internet, when you get the inevitable negative review, it will be diluted. And I will tell you that having an occasional negative review is even better than having 100% positive reviews. So a grade of 4.9 is perceived as better than a 5.0. Grade of 4.9 is perceived as better than a 5.0. Why? 5.0 is perceived as marketing material. It basically suggests you've never had a problem. But if you have a 4.9, it suggests you have had a problem, and the public wants to see how you manage broadly those types of problems. So don't freak out about getting an occasional negative review. There are ways to respond in a HIPAA compliant way. But I think if you have 0 reviews and you just have 1 negative review, then that's going to be 100% of all of your reviews. So you want to plan ahead, and there are service providers, we're one of them, that has a piece of technology that allows you to seamlessly upload reviews from your practice in a HIPAA compliant way from an iPad up to the various review sites. All right, whirlwind tour, let's wrap up. If you touch a patient, that is now your patient. You need to manage that patient. But if you identify that a particular individual is likely to pose a problem before you touch them, you don't necessarily have to invite an elective patient into your practice, because if you invite that patient into the practice, you may be inviting a problem into the practice. Mental health issues, just be on the alert. This is America 2024. There are plenty of people out there who are struggling with various mental health issues masquerading as different types of conditions. Be aware of them. If you can identify and or refer such individuals to receive competent help, you can end up being their hero, but you don't want to be performing procedures on a particular patient if there are underlying issues that will interfere with their perception of the outcome. Conflicts are inevitable, but most of these conflicts can be resolved without escalation and going to war. And then finally, as an alternative to court, consider arbitration at the very beginning. When the patient first comes into the practice, I'm a big fan of arbitration. So I've gone through my whirlwind tour, and I'm going to open this up for questions if we have any. I'm going to put my camera back on. Here we
Thank
go.
you. Thank you. We do have a question from Dr. Patel. And let me see here. I think that I can give him the opportunity to ask it himself. I'll try that real quick. And
Let's do it.
Dr. Patel, you are unmuted, and I don't know if you're active or not, or got pulled away. But if you're there, would you like to go over the question that you emailed me?
Sure. Good afternoon, y'all. Thanks for a great talk, Dr. Segal. Really appreciate your insights, especially as a surgeon. And I'm an MD-JD myself, so I especially enjoyed your input too.
Excellent.
So you touched upon it with your solution to pollution is dilution slide, and I even tell that to students of mine who are eventually going to practice as well. In my situation, I've done that, and I think we've done a pretty good job. And I totally agree with what you said about a perfect 5.0 almost seeming like not a real number, and having like a high 4 number on these online sites being more helpful. And so I've been doing those things, and I don't know if there's any other tactics you can touch upon from your experience or other clients. You know, AI sometimes filters out good and bad Yelp reviews, for example. That's helped in some cases, it's hurt in other cases. Google is perhaps less using AI like Yelp is from my personal experience. Sometimes they have options to click if it's especially defamatory or not, and I know it's hard to prosecute a defamation claim, although there's rare cases of that happening in plastic surgery that I've read about. So besides just washing out a bad review with a ton of good reviews, is there any other kind of tactical things one can do when it comes to these third-party websites, whether it's Google or some of these other ones out there, Health Grades and some other things that you've mentioned?
No, that's a great question, and thanks so much for. You've got another MDJD here. Excellent. Welcome aboard. It's not a big club. So, yeah, there are other things you can do. I think it depends upon how negative and nasty the review is. So, for example, the ones that are most debilitating to a practice might be one that is front and center and includes pictures. So, if, for example, you have a patient who unfortunately experienced necrotizing fasciitis, those are not flattering pictures when they came in for a tummy tuck and ended up with, a wound vac and their abdomen being packed. Certainly something you would prefer not to see out there. But interestingly enough, if you're going to do a revision procedure, for example, where you waive your professional fee or even refund the money, I would make it a quid pro quo, meaning that I'm certainly open to doing that. I'm open to waiving my professional fee. I'm open to even giving you your money back. And I'd appreciate it if you would remove the reviews you posted on the particular site. You're able to do that most of the time. Most of the time, they're comfortable doing it. Most of the time, the money is very helpful to them. So if they were going to go to another doctor and they need to dig deep into their pocket to get a revision with something else, if they had a tiny war chest to do it, mainly the money that they paid you, it would help accelerate that process. The question is whether that individual can be, is open to communication. And I often get involved as that neutral third party to facilitate. Sometimes the emotions are too volatile. Either the patient that can't talk to the surgeon or the surgeon doesn't want to talk to the patient. I just get involved, reach out, and just say, look, let's see if we can find a way to get to a better outcome for you. And most of the time it works. I wish it worked 100% of the time. I would say it certainly works over 90% of the time, but recently we had one where the patient has clear mental health challenges. I don't know if she struggles with bipolar disorder or something else, but there was just no receptivity to this. It's somebody who's out on a warpath and will not stop no matter what. But also these types of individuals don't look credible and authentic on the internet. It looks like 5 pages of a rant with, horrible grammar and all caps. You've all seen this, and it's just not afforded a great deal of authority on there. So my point is there are a collection of strategies that can be done. I think the more positive reviews that you get up there, having an occasional, if you have the occasional negative review, responding to it in a HIPAA compliant way. You can certainly flag reviews for a terms of use violation, not commonly productive, but sometimes it is. And then finally, you buy them. I mean, you're not opening up the floodgates. If it truly was a result you're unhappy with, I'd be open to it. I mean, you're really just paying for peace, if nothing else.
Thank you, Dr. Stegall. While you're talking and giving your presentation, I actually asked Chat GPT how a physician can handle online defamatory reviews, and Chat almost exactly echoed your presentation. I mean, it gave me 6 headings: monitor your online presence, respond professionally, encourage positive reviews, provide excellent service, use a professional service for reputation management, is an interesting one, address the source, legal recourse, educate patients, and build a strong online presence. That's a lot. I'll share that with you because it's kind of interesting. Um, Another thing too that I wanted to ask you about, one of my sponsors for our veterans nonprofit, which focuses on mental health, by the way, is a company that has a 20-minute online mental health kind of a test that is, with the American Board of Psychiatry, legitimately used and billable. And what's interesting was I thought that was a great idea. So I kind of shopped that a couple of years ago around to some surgical practices. And generally speaking, it was the reaction was, "Oh, that's the last thing I want to know. Please, I don't need any more bad information about my patients." It may seem like a good idea, but they were a little bit skittish about it.
Mark, let me follow up on that because that's a really interesting talk. So, and I'll just keep it narrow in terms of the plastic surgery, aesthetic surgery world. The bane of every plastic surgeon's existence is body dysmorphic disorder. It's a
Okay.
condition where objectively you believe they've got a good outcome, but subjectively, when they look in the mirror, they don't see what you see. It's almost akin to an eating disorder. They don't see what everybody else sees, and they focus on minor imperfections and magnify that. And the last thing you want to do as a surgeon in a patient with body dysmorphic disorder is to reoperate on them. You don't want to operate them the first time, but if they come in saying my brow is 1 millimeter off, you go, oh, I can fix that. It's a cycle of doom. It doesn't get better because it's a frontal lobe problem. It is not a cosmetic or aesthetic problem. But a nurse, and I think she's a nurse practitioner, came up with a questionnaire, part of the normal questionnaire where they're asking patients up front, what do you want? What are you looking for? And buried in the 20 questions are 3 other questions which are designed to be a quick screen for body dysmorphic disorder. So for example, one of the questions is, I want to look 20 again. So if somebody's 50, they're not going to look 20 again no matter what, but that's an unrealistic expectation. Number 2, I want to be perfectly symmetrical. I mean, I know it sounds ridiculous, we're not perfectly symmetrical, but if that is our expectation, it cannot and will not be met. So there are 3 questions in there. It's designed to be a good screen. Occasionally there will be false positives, but she has a relationship with a mental health professional, and in doing so, she found that by not performing a procedure on these patients and having that challenging discussion, getting them to get mental health treatment, they were all better served, and most of them are happy. Not initially, because it's an affront to be told, hey, it can be perceived as an affront, hey, you've got a problem. But ultimately, it's about finding the right solution, the right problem. If a patient came to your practice, and you're going to perform some type of elective surgery, and you thought they may have a cardiac problem, well, you'd want to get them cleared before you operate on them. You'd send them to a cardiologist or to the primary care doctor. It's no different here. You send them to a mental health professional, but most of us don't have relationships, pre-existing relationships, referral relationships with mental health professionals. My point is, get them, get relationships. They're out there, and actually they don't only like taking care of these patients, they love taking care of these patients. You're doing good, you're helping a colleague, and you're getting the right person to the right place at the right time.
Well, that's a great response and a good ending. I thank you very much for your time. This recording will be available not only to those that attended, but to those that registered and were not able to make it. So, Dr. Segal, I'll give you the last word.
Thanks for joining. I appreciate you putting this together. Anytime I get a chance to speak to fellow physicians, even if some are MD-JDs like me, I love it. So I appreciate it. Thanks, everyone.
Oh, thanks, everybody. Have a good weekend.